Good morning, students. Today we are going to see about the ophthalmic artery and vein. So, ophthalmic artery and vein. What are the objectives of this session? How you are going to reading the artery and vein, and what are the titles to be followed? The next slide. Let's see the ophthalmic artery. Just to read, first you have to read about the origin, course, termination, branches, applied anatomy. Then, if you see the ophthalmic vein, almost it is similar. One thing you have to differentiate here, that is origin, course, termination. Instead of branches, you have to read about the tributaries and applied anatomy. Because we will see about the ophthalmic artery. So in this picture, now you can see the dissection of the orbit. This is the eyeball, and you can see the optic nerve here. So this is the ophthalmic artery, and you can see the medial wall of the orbit, and this is the lateral wall of the orbit. And this is the lacrimal gland. You can see the removal of the levator palpebrae superioris and superior rectus muscle here. This is the lateral rectus muscle. Here, this is the superior oblique muscle and medial rectus muscle. So now, first we will see about the origin of the ophthalmic artery. So the ophthalmic artery arises from the internal carotid artery near the roof of the cavernous sinus. So medial to the anterior clinoid process. So just to see this picture. Okay, so this is the cavernous sinus. Now you can see the internal carotid artery entering the middle cranial fossa on the side of the cavernous sinus. So when it passes to the anterior clinoid process, it gives a branch here. This branch is the ophthalmic artery. So after arising from the internal carotid artery, this ophthalmic artery enters the orbit through optic canal along with optic nerve. So when it enters the orbit, it lies infralateral to the optic nerve. Now again see this picture. So this is the optic nerve. See the ophthalmic artery arising from internal carotid artery. So together both the optic nerve and ophthalmic artery entering the orbit. Here the ophthalmic artery lies infralateral to optic nerve. Okay. Now after entering the orbit, see the artery is winding round the optic nerve. Okay, and comes to the lateral side of the nerve, and it crosses the optic nerve from lateral to medial side. So while it crosses, it passes between the superior ophthalmic vein and mesociliary nerve. Now the ophthalmic artery enters the medial wall of the orbit. Okay, so here it lies between two muscles, that is superior oblique muscle and medial rectus muscle. Okay, now we'll go. We are going to see about the branches. Actually, the branches of ophthalmic artery will accompany all branches of the nasociliary, frontal, and lacrimal nerves. And the branches we are going to read under different headings because they are arranged in the following groups. So branches, first group will be the branches to the eyeball, then branches to the orbital muscle, then branches along the lateral wall of orbit, branches along the medial wall of the orbit. First, we will see about the branches to the eyeball. So the branches to the eyeball, it gives one branch that is called as the central artery of the retina. So this is the central artery of the retina, which arises from the ophthalmic artery. It pierces the optic nerve and it enters the posterior part of the eyeball. So here it supplies the optic nerve and inner 6-7 layers of the retina. So this artery is a example for typical end artery. If it is occluded, it produces total blindness. Okay. Now the central artery of retina characteristic feature is it pierces the optic nerve, it supplies optic nerve and inner 7 layers of the retina. Then come to the eyeball. So branches to the eyeball. So the branches, you can see numerous branches are given to the eyeball. They are nothing but the posterior ciliary artery. It may be arranged as long and short artery. If you see the long arteries are two. They form a major arterial circle around the eyeball to supply the iris and the ciliary body. And the short ciliary arteries, they supply the choroid and outer 3 or 4 layers of the retina. Okay, so this choroid, iris, and ciliary body are the middle vascular coat of the eyeball. Okay, so clear about posterior ciliary artery? So now the branches to the eyeball are two arteries, central artery of retina and posterior ciliary artery. Now next we are going to see in this picture also you can see the posterior ciliary arteries. These are the posterior ciliary arteries. Next we are going to see about branches to the orbital muscles. So these arteries are called as anterior ciliary arteries. They usually arises from the muscular arteries. Okay, so they supply the muscles. Okay, so that's why it is called anterior ciliary artery or branches from the muscular arteries. Now branches along the lateral wall of the artery. So the more important artery which arises from the ophthalmic artery along the lateral side is the lacrimal artery. This is the lacrimal artery. So which runs along the upper border of the lateral rectus muscle. So the main supply of this artery is to the lacrimal gland. In addition, it supplies the conjunctiva and the eyelid, lateral part of the eyelid. So what are the branches it gives? It gives one recurrent meningeal branch which passes through the medial end of the superior orbital fissure and anastomose is the middle meningeal artery. So this supplies the meninges of the middle cranial fossa. Okay. Then next, if you see the other branch is the zygomatic branch. So it gives zygomaticofacial, zygomaticotemporal artery. It supplies the area of the skin around the cheek and also the scalp. Okay. Then next comes the two lateral palpebral arteries, which supplies the lateral part of the eyelid, upper and lower eyelid. You can see in this picture two lateral palpebral arteries. These are the superior lateral palpebral, and this is the inferior lateral palpebral. So which supplies the corresponding part of the upper and lower eyelid, which also anastomoses for the medial palpebral artery of the upper and lower eyelid. So that's all about the branches of the lacrimal artery. So branches along the lateral wall of the orbit is the lacrimal artery. It gives glandular branches to lacrimal gland, to lateral palpebral arteries to eyelid, to zygomatic branches, recurrent meningeal branch, and it also gives muscular branches. So the muscle present here is the lateral rectus muscle. So next we are going to see about the branches along the medial wall of the artery. So this is the ophthalmic artery, you can see here. So what are the arteries it gives here? So it gives anterior ethmoidal artery, so which passes through anterior ethmoidal foramen. So it supplies the anterior middle ethmoidal as sinuses. Then it actually passes through the nasal cavity and it supplies the medial and lateral wall of the nasal cavity and also the dura mater. Okay. Then next comes the posterior ethmoidal artery, which passes through the posterior ethmoidal foramen. It supplies the posterior ethmoidal air sinuses and it enters nasal cavity. It also supplies the meninges of the anterior cranial fossa. Then the next artery will be the supraorbital artery. So this is the supra artery with number 5. It is labeled here. The supraorbital artery accompanies the supraorbital nerve. It emerges to the scalp through the supraorbital foramen. Here it divides into medial and lateral branches and supplies the forehead and the scalp. So what are the other branches along the medial wall? So in addition, it also gives two medial palpebral branches, superior medial palpebral branch and inferior medial palpebral branch. Okay, superior medial and inferior medial palpebral branch, which supplies the medial part of the upper and lower eyelid, and it forms an anastomosis with the superior lateral and inferior lateral palpebral arteries. So next, along the medial wall of the artery, it gives two more branches. They are also the terminal branches of the ophthalmic artery. So what are the two terminal branches? One is the supratracheal artery and another one is the dorsal nasal artery. The supratracheal artery accompanies the supratracheal nerve. It also supplies the medial part of the forehead. Okay. Then comes the dorsal nasal artery. It supplies the lower part of the dorsum of the nose. It undergoes anastomosis with the facial artery. That's how there is a communication between the internal and external carotid. So now the terminate branches are the supratracheal and dorsal nasal branch. So here it both ophthalmic artery ends at the medial end of the upper eyelid. Okay. So the branches are over. Just see this picture and identify number 1, number 2, and number 3 and post it to me. Okay. So what is number 1, what is number 2, and what is number 3? Okay. Okay. Now I'll go to the next slide. So next slide. So in brief, the branches of ophthalmic artery, they are arranged in 4 groups. The first group is branches to eyeball. Second will be branches to the orbital muscle. Third is branches along the lateral wall of orbit. So fourth is branches along the medial wall of the orbit. So branches to eyeball are 2 central artery of pigment, posterior ciliary arteries, which are long and short. So branches to the orbital muscles are anterior ciliary artery, which arise from muscular artery. Branches along the lateral wall of the orbit are lacrimal artery. Branches along the medial wall of the orbit are 5. They are posterior ethmoidal, anterior ethmoidal, supraorbital, supratracheal, dorsal nasal, and medial palpebral branches. So the supratracheal and dorsal nasal branch are the terminal branches. So with this, we'll continue on to the next thing, is the ophthalmic vein. So there are 2 ophthalmic veins in the orbit. One is the superior ophthalmic vein, other one will be the inferior ophthalmic vein. So the superior ophthalmic vein, if you see, it runs along the medial part of the upper eyelid. So it accompanies the ophthalmic artery and crosses above the optic nerve along with ophthalmic artery. So it also receives tributes from the accompanying artery, that is from ophthalmic artery. So it passes through superior orbital fissure and finally end in the cavernous sinus. Okay. Now, if you see the inferior ophthalmic vein, this vein begins in the floor of the orbit, so collects blood from inferior orbital muscle, lacrimal sac, and eyelid. So it finally drains into the cavernous sinus. Okay. So in this picture, you can see it has communicated with some other vein. This vein is called as the pterygoid venous plexus. So this communication, the inferior ophthalmic vein communicates with pterygoid venous plexus. So that's how any infection in the dangerous area of the face will spread into the cavernous sinus. I think now you're clear with the superior and inferior ophthalmic vein. Both the veins end in the cavernous sinus. The superior ophthalmic vein, the near the roof of the orbit, in the inferior ophthalmic, in the floor of the orbit. So both end in the cavernous sinus. So with this, I'll finish this class. We'll see you later.